My name is Dr. David Gruener, and I'm going to try and address a few of the most commonly asked questions regarding vein disease and its treatment. One of the most common questions that arises is what are some of the side effects of endovenous ablation? One is a localized bruising, which is very temporary and disappears often within about 1 week after the procedure. The second most common side effect, which happens, is a transient numbness. And this numbness happens in an area where a nerve supplies the skin over the leg, runs very close to the vein in patients that have veins treated very far down their leg. Using some novel techniques that were developed by our researchers at vein centers, we minimize this occurrence of numbness to almost nothing. Another very frequent question we are asked is what are the differences between arteries and veins? The heart pumps oxygen-rich blood through arteries, which are elastic and go down towards the feet and arms. And those areas receive this oxygen-rich blood, utilize the oxygen in the blood, and return the oxygen-poor blood to the heart via veins. There is no heart pumping blood back from your veins to your heart. Blood moves in the veins from muscular contractions and valves. These one-way valves only allow blood to move towards your heart and not backwards in a normally functioning vein. Vein disease occurs when these valves aren't functioning properly and there's leakage in between the valves, leading to blood pooling in those extremities. Another very frequently asked question is how long is the recovery from these procedures? The recovery is very simple, and activity limitations are essentially none. I tell patients your activity limitations are restricted to anything you can do with your compression stockings on. I hope me answering those questions were helpful, and those are some of the most commonly questions we're asked. If you have any other questions that didn't arise in this video, we welcome you to come down to one of our offices and ask in person.